Dr. MariaPaz Sebastian, thank you so much for joining me on this RAUK 21 5-minute interview. How are you?
I'm fine, and thank you very much for inviting me to talk to you these 5 minutes and
Pleasure.
convince everyone to join us in RUK 21.
Well, I'm looking forward to hearing your sales pitch. Well, first of all, I just wanted to welcome you. You have been our latest addition to the RAUK board, and your presence is very much welcome. And you've also taken on a number of roles. You've taken on the role for equality and diversity. You're working a lot on nerve injury guidelines, and you're looking at leadership and management. So we're really excited to have you as part of our community. The first thing I want to ask you is, why are you looking forward to RUK 21?
Well, I'm looking forward to it because it's going to be amazing. And this year has been so challenging, we've been dealing with COVID and we have learned many things, but yes, about COVID, we didn't have, or at least I didn't have time to learn and keep updated in any other, in regional anesthesia or any other thing than COVID. So I think this meeting is the way of doing that. So we are going to have world leading regional anesthesia expert coming to talk nationally and internationally. The topics are incredible. So we have something for everyone, for novice and expert. We are going to talk about compartment syndrome, day surgery, spinals. You might think that there is nothing else to talk about spinals. Well, there is, and we are going to talk about that too, okay? We are going to talk green anesthesia, what is something that we should look, is the way of go forward. And we are going to discuss analgesia for hips, lower limb, everything. So everyone will have something to listen to. So in some meetings, sometimes you can see the program and say like, okay, I think I'm going to miss this talk. Well, I don't think this is the case in RUK 21. All of them are so interesting, and I'm really looking forward to listen to everyone.
I think you're right. I think what we're trying to do is we've got all of our board together to kind of help develop the program. There literally should be something for everyone. And the main advantage, of course, is that you can, once you sign up for it, you can have access to it for a year. So even if you miss something on the day, you've got access afterwards. Well, listen, you've done a pretty impressive job of convincing me that we need to sign up for it.
Yeah.
But is there anything else particularly you would say? So if you were to speak to a trainee now who said, Dr. Sebastian, why should I sign up for RUK 21? Is there anything else you'd add or any other potential advantages you've got for why people should sign up?
Well, if you are a trainee, you have even further reasons to apply. You know that we have prices. So if you can do infographics, which is great, really. We are working already in 3 of them, I have to say,
Oh,
maybe too many.
wow.
But yeah, we are really excited. And I think infographics are a really good way to try to send a message, an important one. So we are doing that. But also, if you have, you can submit an abstract, and your abstract can be published in BGA.
That's amazing. The top 3 abstracts
Amazing.
get published, which is brilliant. Okay, I think I'm going to sign up, Maripath.
Yeah, you have to.
You convinced me. So I
As
need
you
to.
said,
Sorry, say
you
again.
will have access for a year.
Absolutely. Why not? Listen, this is brilliant. Now, you've watched a few of these videos, so you know that at the end of the video, I asked 3 simple questions. And it is slightly artificial to limit your repertoire to these 3 questions, but I'm going to try. So if you had to pick your favorite upper limb block, what would it be?
These questions are quite difficult to answer because there are so many that really you will like to choose. Obviously, interscaling for shoulders, but if I have to choose one, yes, for upper limb, I think my favorite will be axillary because I think it's really easy to perform, low rate of complications, and is so nice to teach because you can follow the nerves, and regional anesthesia is mainly anatomy, and when you teach that, you show the trainees how the anatomy really, and how regional anesthesia is based on anatomy. You can follow the nerves, you can come, scan up, scan down, and really I do like it.
You know,
I will say actually.
I love seeing that enthusiasm in your eyes because it reminds me many years ago when I was a younger consultant, just seeing the anatomy in real life and see how you can see, well, look, here's the median nerve, it's going to flip over here, and I look for the ulnar nerve, and you see the radial come up. So no, okay, I like that, and that's one of our Plan A blocks. So that's
Yeah.
encouraging. What about lower limb?
So lower limb. I love popliteal because I do a lot of complex foot surgeries. But if I have to choose a favorite, it's going to be IPAC because it had completely changed my practice.
Has it
And I
really?
think it's a game changer. Yeah. It's amazing. I remember the first time I did one in 2018 after Astra. And I did it like, okay, it might work or it might not, but it really is a game changer. You can see the patients mobilizing in recovery, mobilizing day zero, no regular opioids. It's so easy to perform too. So now our surgeons are asking us to do IPACs on total knee replacement, but to make you think like this is really working because they can't see that it's really working. So I will say IPAC for my favorite one in lower limb.
Okay, well, that's really interesting, and certainly if you can get buy-in from your surgeons if they're requesting it, that's really
Definitely.
something. Okay, last but not least, MariaPaz Sebastian,
Oof.
I'm going to ask you about trunk block. So, what is your favorite trunk block?
So there are so many,
Hmm.
but if I have to choose one, I think I'm going to go for a paravertebral because I think the quality of the analgesia that it gives you. I know it's not the easiest one,
That's okay.
but the quality of analgesia I think is really good. So I will go for the paravertebral.
Well, once again, like Dave Johnson picked paravertebral for his trunk block, I'm really happy you have. I think I built my whole initial part of my career talking about paravertebral, so I am totally won over by that. I think it's brilliant. Um, MariaPaz Sebastian, your thoughts and your insight has been fantastic, and you do have the role of keeping me in check. You're chairing one of the sessions that we're doing, so
Yes.
I wish you best of luck with that. Thank you so much for taking the time to speak to
No, my
us,
pleasure.
and we
My
look forward
pleasure.
to seeing you at RUK 21.
Yeah. And I hope I see everyone there too.
Exactly. Take care. See you later. Bye
Thank
bye.
you very much for inviting me. Bye.
Bye bye.